Diabetes type 1, also known as juvenile diabetes or insulin-dependent diabetes, is a chronic autoimmune disease in which the body's immune system attacks and destroys the insulin-producing beta cells in the pancreas. As a result, the pancreas is unable to produce sufficient amounts of insulin, a hormone that regulates the amount of glucose in the blood. Insulin helps the body use glucose for energy and also helps to store any excess glucose in the liver, fat, and muscle cells. Without enough insulin, glucose builds up in the bloodstream and can cause high blood sugar levels, leading to a range of health problems. Type 1 diabetes usually develops in childhood or adolescence, but it can occur at any age. It is typically diagnosed in individuals under the age of 30 and affects approximately 5% of all people with diabetes. The exact cause of type 1 diabetes is unknown, but it is believed to be a combination of genetic and environmental factors. People with a family history of the disease, as well as certain viral infections, may be at increased risk of developing type 1 diabetes. Symptoms of type 1 diabetes may include increased thirst and frequent urination, extreme hunger, blurred vision, fatigue and weakness, numbness or tingling in the hands and feet, slow healing cuts or infections. If left untreated, high blood sugar levels can lead to serious health complications, including cardiovascular disease, nerve damage, neuropathy, kidney damage, nephropathy, eye damage, retinopathy, foot damage, which can lead to amputation. Diagnosis of type 1 diabetes is usually made through a combination of blood tests, including a fasting blood sugar test, an oral glucose tolerance test, and an A1C test. An A1C test measures the average blood sugar level over the previous 2 to 3 months. Treatment for type 1 diabetes involves daily insulin therapy to replace the missing hormone and help regulate blood sugar levels. There are several different types of insulin available, including rapid-acting, short-acting, intermediate-acting, and long-acting. The type and frequency of insulin used will depend on individual needs and the severity of the disease. In addition to insulin therapy, people with type 1 diabetes should also follow a healthy diet, engage in regular physical activity, and monitor their blood sugar levels regularly. This can help prevent or minimize the development of long-term health complications. Living with type 1 diabetes can be challenging, but with proper treatment and self-care, many people are able to live healthy and active lives. Regular checkups with a healthcare provider, support from friends and family, and participation in a diabetes support group can also help individuals manage their condition and maintain their health. In conclusion, type 1 diabetes is a chronic autoimmune disease in which the body's immune system attacks and destroys the insulin-producing cells in the pancreas. Without enough insulin, glucose builds up in the bloodstream and can cause high blood sugar levels, leading to a range of health problems. However, with proper treatment, monitoring, and lifestyle changes, many people with type 1 diabetes are able to live healthy and productive lives.